2024 Nurse Aide, CNA, Practice Test. Let's get started. A resident who is lying in bed suddenly becomes short of breath. After calling for help, the nurse aide's next action should be to: Is it A, ask the resident to take deep breaths? Or B, take the resident's vital signs? Could it be C, raise the head of the bed? Or lastly D, elevate the resident's feet? The correct answer is C. Here is why. Sitting the resident up or raising the head of the bed is an immediate, non-invasive action that can improve lung expansion and ease breathing difficulty. Instructing a distressed resident to take deep breaths may be impossible and is not the first action. Taking vital signs is important, but will be done by the responding nurse. It delays immediate relief. Elevating the feet would worsen shortness of breath by increasing blood return to the heart and lungs. Next question. A resident who has cancer is expected to die within the next couple of days. Nursing care for this resident should focus on: Is it A, helping the resident through the stages of grief? Or B, providing for the resident's comfort? Could it be C, keeping the resident's care routine, such as for bathing? Or lastly D, giving the resident a lot of quiet time and privacy? The correct answer is B. Here is why. In end-of-life care, the primary goal shifts from curative or rehabilitative measures to palliative measures that ensure physical and emotional comfort, such as pain management, positioning, and oral care. While grief support is part of psychosocial care, the immediate focus of all care actions is comfort. Rigidly maintaining routines may not align with the resident's declining energy or wishes. Quiet and privacy are important, but are components of providing comfort, not the overarching focus. Next question. While giving a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should: Is it A, wait a few minutes to see if the alarm stops? Or B, report the alarm to the charge nurse immediately? Could it be C, make the resident being bathed safe and go check the door right away? Or lastly D, stop the bed bath and go check on the location of all assigned residents? The correct answer is B. Here is why. Door alarms are critical safety devices, often indicating a resident at risk for elopement. The immediate response is to alert the licensed nurse, who can initiate the facility's elopement or emergency protocol. Waiting could allow a confused resident to leave the facility unattended. Leaving the resident being bathed unattended, even briefly, is unsafe. Stopping care entirely to check all residents is not the most direct and efficient way to address the specific alarm. Next question. Gloves should be worn for which of the following procedures? Is it A, emptying a urinary drainage bag? Or B, brushing a resident's hair? Could it be C, ambulating a resident? Or lastly D, feeding a resident? The correct answer is A. Here is why. Standard precautions require wearing gloves whenever there is a reasonable expectation of contact with body fluids, such as urine, which is certain when handling a drainage bag. Brushing hair does not typically involve contact with body fluids. Assisting a resident to walk does not require glove use unless there is contact with bodily fluids. Feeding does not involve contact with body fluids unless the resident is incontinent or drooling excessively, which would be a specific situation. Next question. When walking a resident, a gait or transfer belt is often: Is it A, worn around the nurse aide's waist for back support? Or B, used to keep the resident positioned properly in the wheelchair? Could it be C, used to help stand the resident, and then removed before walking? Or lastly D, put around the resident's waist to provide a way to hold onto the resident? The correct answer is D. Here is why. The belt is secured around the resident's waist, providing a safe and secure handhold for the aide to support and stabilize the resident during ambulation without grabbing clothing or limbs. It is not a back support device for the aide. While it can assist in transfers, its primary use in walking is to provide support during ambulation, not just for standing. It is not typically used to position someone in a wheelchair. That is the function of seat belts or positioning devices. Next question. Which of the following statements is true about residents who are restrained? Is it A, they are at greater risk for developing pressure sores? Or B, they are at lower risk of developing pneumonia? Could it be C, their posture and alignment are improved? Or lastly D, they are not at risk for falling? The correct answer is A. Here is why. Immobility caused by restraints reduces circulation and increases unrelieved pressure on skin, dramatically increasing the risk for pressure injuries. Restriction of movement can actually increase the risk of pneumonia due to poor lung expansion and ineffective coughing. Restraints often cause poor body alignment and can lead to contractures. Restrained residents are still at risk for falls, often more severely, if they attempt to get out of the restraint. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.